When was the last time that you've heard of anyone being diagnosed with polio? It's hard to imagine a disease that you have never seen yourself. However, keep in mind, there is a reason that children are still vaccinated for the polio disease today. So just when was the last time that Americans saw the poliovirus? There has not been a naturally occurring case of paralytic polio since 1979, and at that time it was amongst the Amish community where vaccinations are not readily acceptable. Prior to that, polio had not been seen since the epidemic of the 1940s and 50s, where polio was the most feared childhood disease. However, as recently as 2005, 3 cases of children possessing the poliovirus in their immune systems have been documented. Now, these children did not contract the paralytic form of this disease. However, only non-immunization can be contributed to the rise of this once eradicated disease. What is polio? Polio is a contagious virus that enters through the mouth and multiplies in the throat and gastrointestinal tract, then moves into the bloodstream and is carried to the central nervous system, where it replicates and destroys the murdered neuron cells. These are cells that affect basic human functions such as respiration, swallowing, and even as far as motor control of the legs and arms. How does polio infect the body? Poliovirus infects human cells by binding to an immunoglobulin-like receptor on the cell's surface. Once inside the cell, the virus hijacks the assembly process and makes thousands of copies of itself in hours. The virus kills the cell and then spreads to infect other cells. It is unknown why the virus favors motor neurons over other cells in the bodies, though its preference for motor neurons does make paralytic polio more prevalent. How did polio become an epidemic? Polio is highly contagious and can be transferred from person to person through oral or through the presence of fecal matter. About 95% of all polio cases, the person has no symptoms at all. These are known as asymptomatic cases. The rest of the polio cases can be divided into 3 types: abortive polio, non-paralytic polio, and paralytic polio. Abortive polio is a mild illness with viral-like symptoms such as fever, fatigue, headache, sore throat, nausea, and diarrhea. Typically, those affected with abortive polio will get over the disease in about 5 days. However, during this time, they are able to transmit it to other susceptible people. In non-paralytic polio, these cases typically involve the symptoms of abortive polio, with the addition of neurological symptoms such as sensitivity to light and neck stiffness, as well as spinal and some muscle stiffness. These people will get over their illness in about 5 to 10 days. However, just as in abortive polio, they are able to transmit the virus the entire time that they are ill. So what does paralytic polio look like? At the first signs of paralytic polio, after initial period of viral-like symptoms, typically begin with the loss of superficial reflexes and muscle pain or spasms. Paralysis, usually asymmetric, follows. In most cases of paralytic polio, the patient can recover completely. However, for a certain number of people, paralysis or muscle weakness remains for life. This is especially increased the older the person is who contracts polio. Children who contract it can be treated, and muscle correction as well as bone structure correction can be implemented through the use of braces. However, those older affected with polio may live with their symptoms for life. There is no cure for polio. Prevention is the most effective means to combat it. Certain drugs and therapies can offer supportive care for patients to counter some of the effects of muscle involvement. Patients who progress to paralysis of muscles involved in breathing will receive artificial breathing support. This is a photo of a negative pressure breathing chamber that was used to treat patients in the early stages of polio who had difficulty breathing. This was referred to as the iron lung. Patients could be inside of the iron lung with assisted breathing for 1 to 2 weeks. If they could survive this period of limited breathing, their likelihood of full recovery increased tremendously. This is what the life of a young child with polio looks like. Braces, crutches, and endless hospital visits until they can either be well again, or this could continue for the rest of their lives. The vaccine. There are 2 polio vaccines used throughout the world to combat polio. The first was developed by Jonas Salk through the use of HeLa cells, first tested in 1952, announced to the world by Dr. Thomas Francis Jr. on April 12, 1955. It consisted of an injected dose of inactive or dead poliovirus. An oral vaccine was developed by Albert Sabin using modified poliovirus. Famously, President Franklin Roosevelt was thought to have contracted polio later in his adult life, which left him without the use of his legs. However, with the use of braces and canes, he was able to appear as though he could walk in many of his public speeches and outings. These are the sources we used for our photos, research, and music. Thank you for your time. This presentation was brought to you by Claire Plucho, Star Hernandez, Sadie Duthu, and Zeke Guidry. And please remember, the polio virus is 100% preventable.